Symptoms of depression. Depressive disorder, also known as depression or major depressive disorder, is a psychiatric, mental health disorder that affects your mood. Depression can cause a variety of emotional, behavioral, and physical symptoms. A common misinterpretation about people with depression is that they are just sad. However, depression is more than having a bad day or going through a rough patch. People who have depression typically experience chronic symptoms, meaning they have symptoms for more than 2 weeks at a time. Depression is a common, but severe mood disorder which affects nearly 280 million people globally each year. Each person experiences depression differently. Some people might only have a few symptoms that get better over time, while others have several symptoms that may get worse. Depression can also be hard to detect because some people may choose to hide their pain and feel their emotions in private. One of the hallmark types of symptoms people with depression experience are emotional symptoms, or symptoms that affect your mood. These symptoms may include 1. Extreme sadness, anxious thoughts, hopelessness, pessimism or a negative outlook on life, irritability, guilt, frustration, restlessness. If you begin to experience emotional symptoms, it is common to also notice changes in your behavior, and that's okay. Many people with depressive disorder may experience changes in their sleep schedules, appetite, and energy levels, among other aspects of your daily life. Symptoms of depression usually begin in late adolescence or early adulthood. 3 But children and younger teenagers can also have depression. The American Academy of Pediatrics estimates that as many as 20% of young adolescents experience depression as teenagers, while up to 3% of children under the age of 13 have depressive symptoms. 4 The most common symptoms of depression in children are sadness, irritable mood, or acting out, and a loss of interest in their favorite activities. You may also notice that your child no longer wants to hang out with their friends, engage in their hobbies or extracurricular activities, or go to school. Depression can also affect men and women differently. Research shows that depression is about twice as common in women and girls than it is in men and boys. More research is needed on the sex differences of depression, but early studies show that hormonal changes may increase your risk of developing depression. 3 Depression doesn't discriminate, meaning everyone can experience hard days, sadness, and periods of grief. However, if you notice that your feelings are keeping you from being able to fully participate in and enjoy your life for long periods of time, it's time to reach out for support and talk to your healthcare provider. Before going in for an appointment with your primary care provider or mental health professional, consider keeping a journal to document changes in your emotional, behavioral, or physical symptoms. This can help your provider notice any patterns in your lifestyle and help you find ways to manage symptoms and improve your well-being.